Free Game. It's your host, Luke Gerasi. Today, it's actually just me in here with Michael Goldberg. No co-host today. So I had the pleasure of meeting Mike. I think you're one of the first people I actually met at that event. I think so.
For me too.
This Elite 365 program that Jesse Itzler kind of put together, and just the most interesting people. There's the most interesting room I've ever been in, and I've been in some interesting rooms in my life. That was wild. So Michael was the CEO of a large hospital in New York City during COVID, which was obviously greatly impacted. I think you said they won an award, right? Or maybe not.
Multiple awards for many different things, but there's a documentary based off of what we experienced, and ultimately it's very well known. It's super awesome. So, what was it like living through a pandemic as a hospital leader in one of the first places impacted in the country? Very surreal to start. And I actually, to back up a second, I just want to say thank you for the invitation to come and speak with you on the Free Game podcast, and how incredible it was to meet you and connect with you in Minnesota and Wisconsin and do some of the things that we did there, which were absolutely just life-changing in so many ways. And as you said, the people that we got to do it with are just... I would love to see them on here and listen to their stories, because 2 days wasn't enough.
It wasn't enough.
And it's just great people.
And just kind of touch base what we did. We actually jumped in ice water in, Minnesota and Wisconsin, like 32 points. It took them like 2 days to cut through the ice. It's not an exaggeration.
I think it was like 18 inches thick.
Because when we got there, they cut all the way. The chainsaws went dead. They couldn't cut through it. And they had to keep cutting in the night and into the next morning before they finally got it open. It was nuts. It
was like a swimming pool in the middle of a frozen lake.
Right.
And it was actually warmer water than it was temperature outside.
Yeah.
I think it was 8 degrees outside, so the water was warmer than what we were experiencing outside where we were sleeping.
Yeah.
Right? And so, really incredible experience.
And Michael had found that program right after. You explain how you found the program and all that.
Yeah, so I got an email about it. Towards, I'll get to some of the punchline. I left the organization that I was at after 2 years leading the hospital through a pandemic and all the other great things that I got to do there for 21 years with some incredible people. I mean, we talked about just now some of the people we met in Elite 365, but when you talk about healthcare and you talk about the people who are delivering the care and planning the care and strategizing for the community that they serve, I've had the gift of being able to work with some of the most talented, incredible, caring people, and I have them in the highest regard for what we've lived through together. But I went through that experience, and I decided, having been through it after about 2 years of it, right, and at this point it's a little bit longer than that, it was going to be time for a change, and I needed to do something different in my life, and I needed to connect differently with my family, and we'll talk more about, I'm sure, the pandemic, but one of the things that I saw, in addition to great triumph and success and connection and the team being there and showing up when the world was shutting down, I saw a tremendous loss. There were hundreds of people who lost their lives due to the pandemic, and it's a partially different view than what some people see when you're just out in the public and you're not living in a hospital setting. And I wanted to reflect on that at some point in time and say, what's the lesson we can get out of that? Like, why are we going through a pandemic, and how can we as people be better? And so my lesson that I took away from it was that I wanted to be better at home. I wanted to be better outside of work. I wanted to be better connected with my family. And so towards the end of the year, I left the role that I was in, and at that same time, I don't know what you call it, fate. You call it something that is just timed appropriately and not anticipated, not planned.
I don't believe in coincidence.
Yeah, I want to talk more about that too. And I got this email from Jesse Itzler saying, "Hey, I've got this great mentoring program that's starting up with these incredible mentors, very talented in their own right, and would you like to be a part of it?" And I sat down with my wife, and we went through what we knew for the information in the program, and we said, there's no better time. I mean, think about it. How can this email have come at a better time? I never, working 24 hours a day, 7 days a week, being on call, would have had the opportunity to be so present, to be part of a program like this. And so within 48 hours, I was signed up, I was accepted, I was paid, and and I was going to experience two really incredible trips and have a life-changing year in 2022 and meet some incredible people.
That's awesome. So what was your schedule like, running a hospital during COVID?
My schedule always was long days, early meetings, late meetings, dinners, and then a full day in the middle of that, and sometimes events on the weekends as well, but also being on call 24 hours a day. So 2:00 in the morning, something happens in the hospital, you get a phone call, you deal with it. Sometimes you have to escalate it, sometimes you have to go in. And so I was used to being connected to the hospital 24 hours a day, 7 days a week. The pandemic hit, and it actually, I would say, hit sooner than the first cases arriving. So our first cases in New York started to arrive in early March of 2020. In January, we started our on-site planning for what was going to be potentially experienced. What would the pandemic look like?
When were you guys aware? You probably were one of the first people to become aware of what it was.
We were learning about it towards the end of December, beginning of January of end of December 2019, beginning of January 2020. We weren't as concerned about what it was going to look like from a clinical care perspective. More so, one of the things we went through every year, multiple times a year, was always planning for different types of events. And one of those events that come up every year is the flu. And the flu is a situation where it taxes hospital capacity on an annual basis. And it's coming. And so since we know about it, we always take out our plans, figure out where we're going to adjust our operations and be prepared for it. So we did that, and then we thought that this was going to look a little bit more like that during the December-January timeframe. Towards the end of January, we started to get reports from overseas that it was going to be much more significant than what was being initially contemplated. So we started to host town halls. We started to understand what was going to be important for our team members to know about and what their main questions and concerns would be. And then by the middle of February, we were starting to anticipate that cases were going to arrive. And then by March 4th, I think, we had our first admission to the hospital. And very quickly, it went from 1 to hundreds.
And then it's kind of a weird question to ask, but when was the first death that you saw there from, not that you saw at the hospital, but from COVID?
I don't remember the exact date.
Was it in March, or did it take a while?
It was March. It was definitely March that people were passing away. And one of the things that I remember was very significantly, when you're in a hospital, you see on the TV shows all the codes, right? You always see when they call a code, the team rushes in. Well, that happens on average maybe once a day. At the peak, it was happening once every 37 minutes. And so you would hear that alert go off every 37 minutes. Now, sometimes it would batch, and you'd have 6 codes in 20 minutes, and sometimes you would have 2 hours where you didn't hear anything. And so I would respond to those codes, not respond from a clinical practitioner standpoint because I'm not licensed to practice, but more from a leadership perspective and wanting to support the team, be there with the team, and understand how they were managing and handling these situations, and also to understand how the patients were doing. And so I happened to have been present multiple times, sadly, when people hadn't made it, hadn't survived. But the team worked heroically and worked flawlessly from a clinical practice perspective. And it was tough on them because it would happen as frequently as multiple times a shift for somebody who sometimes wouldn't deal with that for weeks or months, and they were experiencing loss.
It's got to be so nuts to be one of the surgeons or just one of the doctors in there all the time. So what do you do then? How do you? So you said you respond to help them, not to help them, to be there, but to support them. What does that look like from a procedure standpoint? Do you know what I mean? Am I saying that right?
I stay out of the way.
Okay.
That's the number one thing.
That probably makes sense.
When there's a code that's called, there's a very specific protocol for how people will respond, which people in the hospital respond. There's a team of people that specifically that's their role. And then if there are multiple codes, there's other backup systems for that to happen. And that would happen as I mentioned multiple times, I would respond to the location. And usually there were more people at the location than actually helping the patient, because they weren't needed in the actual clinical care, but they were there for additional backup. And so that would give me an opportunity to engage with them. And then depending on the outcome, it didn't matter if it was positive or negative, I would always try to connect with the team as well. Support them if it didn't go well, and support them if it did, and understand in all situations, what can I and the leadership team of the hospital be doing to make sure that they have the support that they needed to address the next one better if it was possible, or just from their standpoint emotionally.
And then did you notice, well, my view, I don't know if it's accurate or not, probably not, but did you notice like any difference really, I don't want to say the type of person, but the demographics of people that are coming in with it sick? Because from my understanding, again, it's super ignorant on my part, it was just fat older people that were really like dying.
It was overweight people with comorbidities and minorities.
Oh, really?
Mm-hmm.
I didn't know that part, but
definitely in the first wave. I don't remember as many of the statistics in the second and third wave, and I can't answer for you whether or not it was more to do with something related to the ethnicity or the proximity and situation where the COVID was spreading.
Okay, and was that like with most hospitals or your hospital in particular?
It was for a lot of hospitals, specifically New York City. And New York City, as you may know, is one of the most diverse parts of the country. And so when you talk about diversity and you talk about New York City and New York City being heavily impacted, they go one and the same. And it did highlight some differences in the type of care that's available for people, though.
That's pretty interesting.
And when you think about how COVID spread, also, right? And we were talking before a little bit about masks, but so much of the city relies on public transportation. And so if, close confines, tight quarters, whether it's buses, trains, tightly packed buildings, a lot of people traveling in the city in different ways. And so it is possible that had a large portion of to do with the spread. Although that's the first set of the wave. After that, it went global.
And then, so obviously, I think I've said on here every time is just how much I am the anti-mask. Did you say that you have to wear a mask again on public transportation in New York? In New York,
yeah. So a couple of weeks ago, we're here today at the beginning of May. So 3 weeks ago, maybe there was the reversal of the mandate.
I'm so excited about flying this upcoming week. I'm like, oh, I got to wear one, which is so simple and dumb, but I honestly am so excited about it.
Yeah, so I think the day that reversal of the mandate came out, either that day or the day after, New York State came out with a revised policy that in New York, you still must wear a mask in public transportation, on trains, and in the airports.
And the data has proven that it hasn't made a difference. Basically, is that fair to say?
I don't know about the data specifically. I could tell you my interpretation of what I see.
Yeah, for sure.
So, I mean, if you think about the wave that we went through in December and January, just of this past 2021 into 2022, 1.5 million New Yorkers got COVID, and there was a mask mandate.
And a very highly vaccinated area.
And a very highly vaccinated percentage. Now, while there was a high positivity rate of people with COVID, there wasn't a very high need for hospital services, and there also wasn't a very high result in mortality.
That's a great sign.
And so to where you're going with the masks, I do wonder what is the value of the masks in public transportation or any other location if you look across the country and you see the incidences of COVID positive results and everybody in those locations wearing masks during those times.
And then you had another interesting point too when we were talking before, which I completely forgot about. When COVID first came out, the concern was keeping hospital beds open.
Yes.
And then it changed to stopping
the spread,
deaths, and then it went the spread,
flattening the curve.
Then it went flattening the curve, and 2 weeks till normal, and the narrative just kept changing. How did you noticed that or experienced that working in the hospital?
Yeah, I can't tell you the exact moment when it changed, when I noticed that it changed, but it was something where it kind of hit me, where I was paying very close attention to the differences of what was happening at different points in time. So, as you said, we were talking about the reason for the shutdown that was communicated in the beginning of March 2020 was to create enough capacity for hospitals to be able to take care of people who are sick. It wasn't to stop the spread of the infection. And then that was done, and the hospitals got overcrowded, managed incredibly well, by the way. They were done. Everybody that needed care got care, and that's one of the things that I would say we should be very proud of in our country and specifically in New York. And then everything started to slow down a little bit by May. And then we had the Black Lives Matter movement, and people took to the streets.
That was George Floyd, right?
Yes.
It was May.
Yeah, that was May.
That was such a crazy fucking year.
It was, and that's only the second thing, right? Because then later on that year we had where I'm going with the Black Lives Matter movement is that you had large gatherings of people in the streets.
Right. Yeah.
And as a leader of a hospital, I prepared the team and I said, listen, if this thing is going to spread like it did the first wave, we better be prepared for a really busy summer, right? Because all these people are gathered again in close proximity, and not everybody was wearing masks. And it was interesting because I think that's the moment where I started to question, how is this spreading? Because we didn't see another influx of people like we had in the first wave. And so I started to think, is this really spreading the way we think it's spreading? How is, and when we were getting less busy in New York, other parts of the country were increasing, right? And so I was trying to pay attention to those dynamics. And then we go through the summer, maybe August starts to climb a little bit, goes back down. And then you get into the presidential election timeline, and again, large gatherings of people. Now you got both sides, both parties,
right.
Large groups gathering, and some masked, some not, but again in large groups. And I said again to the team, let's be ready, let's be prepared. We're going to start to see another influx. And it didn't start to happen until Thanksgiving that year. Between Halloween and Thanksgiving, that next wave really started to increase in New York. Now, this is the New York timeline. And that really became our second wave. And so somewhere in between the Black Lives Matter movement and the presidential election campaigning, I really started to think something's not adding up. It's not connecting between positivity rates and hospitalizations.
Right. Which is really interesting to hear. And then I don't know if this is true or not. You could actually probably tell me, but that there was like incentives. Did I ask you this in Minnesota? That like the hospitals got more money if somebody died and it was a COVID death or something?
So there was a difference in reimbursement.
Yeah.
Based off of the dynamics of what somebody coded as, and I guess yes, there was a difference. I don't know the amount. I didn't look specifically at the finances during that time. What was most important to me was the appropriate, accurate recording of somebody's condition, and I think that where I was working, really valued that more than anything else.
Nice. Do you think? Because I think somewhere in California said that. I'm pretty sure. I should double check this. That like they had. Inaccurate data, basically, like that they had let out, saying that there was way more deaths of COVID initially than there was. I don't know if that could be like a natural human thing. If I'm a doctor and I'm hearing about this thing all the time, I might naturally assume that if he had it, that's what caused it. Mm-hmm. Is that again? I know how none of this works. Yeah. Is that a realistic possibility?
I think there's a bunch of different dynamics to consider in this portion of our look back for COVID, right? When you're in the middle of it, it's happening, and you've never been through it before, and everybody, as you said before, when you referenced the surgeon, doctors, right. All hands on deck. right? Everybody is doing absolutely everything possible to make sure that the community is cared for every person who comes through that door. And people who are working in the healthcare environment are doing whatever jobs possible to make sure that the hospitals can function. I think when we were learning about a new virus, right, something that hasn't happened, a situation that hasn't happened in 100 years in our time, right? So basically nobody that's working in healthcare today lived through one and is still working in healthcare today to do, the last one from the flu of 1918. I think when you don't know enough about the medicine of this specific virus, people died. And if they had tested positive, and by the way, if they were brought in and they were already deceased and they tested positive, it was nearly impossible to determine if it was something other than COVID.
Yeah, George Floyd was originally labeled a COVID death.
Oh, I didn't know that.
Yeah, he was originally labeled a COVID death, and then obviously they went back and changed that. But I remember being like, all right, this is kind of weird.
Yeah, how do you distinguish if somebody died of a heart attack or if somebody died of COVID? If they died in their home and they were brought in by an ambulance, at that point in time when you're in the middle of a pandemic where all you see is COVID deaths and you see them happening in front of you, it's easy to assume, and it's logical to assume that that's what's killing everybody.
Right.
And so, I don't think that there was any malice in the
healthcare
industry.
I can imagine that being a natural, it's just how you're thinking and labeling it that way. I would probably do that. And then obviously that's what you're seeing every day working in matching ICUs and so where would you spend? How does that work? How does a hospital CEO's day work?
During a pandemic or
during a little bit of both, I guess.
A lot of hours there. And it's an in-between role for a place where I was, which was an organization of multiple hospitals, where it's managing what's happening on the day-to-day in the hospital and keeping a structure and tabs and culture and engagement and the quality focused on, while also understanding the information that's being relayed to you from your organization, and then relaying back the relevant information so that the organization can function. So I would spend a large portion of my time understanding what was happening throughout the hospital, understanding the dynamics. One of the things that was critical, but our systems weren't set up for it, was tracking and trending the information. So there was no electronic way when the pandemic started to know how many people we had with COVID and where they were.
Really?
And it sounds kind of ludicrous, right?
Yeah.
But it started with us tracking on a whiteboard, then moving to Excel, and then moving to a database as the volume grew, and it grew very, very quickly. So the first thing was, understanding who was there and where. Second thing was managing them, obviously. From my perspective, it was, do we have enough people? Do we have the right locations of care? And preparing them in advance. And so I would spend a lot of my time on that. And then it was walking through the hospital and being there for the team. And I did it both physically and virtually, right? And one of the ways was going to a unit. And I remember going to the very first ICU where the first COVID patient was. And everybody was scared, right? Everybody felt uncertain. We walked into the ICU and we had on our mask, a regular procedure mask, same thing that people are still wearing,
right.
In some parts of the country and some on planes. And the team, all gathered around us and they said, why is this mask enough? We've got COVID here. When you turn on the news, you see China and you see Italy and you see people in full hazmat suits. Why should we trust that this mask is enough?
The mask that can't stop you from smelling a fart.
Yeah. Yes. And so
it's going to stop COVID.
And so, as a leader, in the ICU, in that moment, my answer to them was, because I'm wearing the same thing you are. And you're going to have access to the exact same information and the exact same equipment that I have, if not better. And right now, this is what we have, and this is the best of the information that's being provided to us. And even then, there was disagreements between the WHO and the CDC. but we were going to go through it together. And then I took that, and I realized I couldn't be in all, 20-something units all day, every day, interacting individually with everybody. And I started to build a social media presence on top of what I had already started to build. But now that became a platform for me to virtually be there with the team and communicate with them, and for them to have a sense of confidence and trust that the information they were getting was coming directly from me, and it was a two-way street. And so I started opening up questions for them to answer, for me to answer for them ongoing. And I would do it at midnight on a Saturday. I would do it whatever time I could fit it in between managing the hospital with the team, with the administrative team. And I started having a two-way conversation. It gave me the best line of sight to where the concerns were in the hospital. It gave me the best information.
This is the social media?
Social media side, yeah. It gave me, it was really the most powerful thing that I could have done, was connect with the team through social media in order to anticipate their needs. Right away, I was getting questions like, can we shower before going home? I'm concerned about taking this home to my family. No problem. We closed the gym. We had built a gym a couple of years prior to that. Close the gym, showers are available to you, feel free to use them. You can't use the gym equipment, but you can use the shower. Some people wanted scrubs. We got the scrub machine, parked outside of their unit for them, and they were able to change their clothes. And these are people who didn't typically change their clothes before going to the hospital. And there were many other requests that would come in, and we would manage them, and we would handle them, and we would take care of them. And it became really a way where I felt the entire anxiety in the hospital start to decline.
People just want to be heard. Mm-hmm. Especially going through some anxiety like that, where there's uncertainty everywhere.
And in addition to hearing, it was delivering on the things that we were able to deliver on and commit to them, so that they knew that they were heard. It wasn't just, oh yeah, we hear you, we're going to take care of this. No, this is important to you. We understand the risk of the area that you're in, and we're going to do something about it.
That had to be. Do you know if any other hospitals were doing stuff like that?
I don't know any other leader
that's
used social media the way that I have.
This could be a huge win for you.
It was, the only way that I could say it probably is not for me, but for all of us. But because the followers went up, many members of the community found us and started to support us with different ways to either promote health, promote wellness, or support, show signs, send messages that I was reposting for them. We wound up on Some Good News. We wound up on Tank's Good News. Wound up on a whole bunch of different places where, there was a moment at the peak in April of 2020 where I made a video. We had just celebrated the first person to leave the hospital as a survivor of COVID. And I noticed
that's
that
pretty cool.
Somewhere along the way in those first 6 weeks or so, nobody was talking about positivity. Nobody was talking about survival. Everything you heard about was concern about mortality. If you got COVID, it was the end, right? And so we clapped out a patient. We called it a team home. We would call it over the loudspeaker. Whoever was available and free and in between shifts or on a break, they'd come down to the lobby. And as the patient left, everybody would applaud and cheer. And something was happening in that moment. When I looked around, I saw the team wasn't just clapping for that person who they were really proud of going home. They were clapping for them. They were clapping for society. They were clapping for the fact that we were going to win, right? We were going to beat the virus, and we were going to be able to take care of this, and there was light at the end of the tunnel. And so I recorded it real quick, and I posted it to social media, and then it went viral. And tens of millions of views and different people who reposted it, and everybody suddenly, I felt, beyond the hospital, realized that there is hope, and I can tell you that was a day where the dynamic changed, and the power of social media allowed that to happen.
I'm always negative on social media, not like I'm posting negative. I'm not usually a big fan of it, but that's pretty awesome.
Yeah.
That made me try to think of a new way. Maybe I can do something with work.
And all of what I've built around social media for work initially was about positivity. And one of the things I recognized was there was a lot more positive interaction on my account than a lot of other ones that you see.
Yeah, that makes sense. I mean, you get what you give.
Yeah.
So, so as that happened, like, what was it like to go? Not to jump too far ahead, but what was it like going from, you know, having some of these doctors and surgeons working around the clock with you to, I know not all of them got the vaccine, and we were saying, you know, probably the shittiest part was having to let some of those guys go.
Yeah.
Well, can you kind of give your personal views on not the hospital's views, but your personal views on that?
Yeah, it's a difficult situation. The you know, when you talk about the vaccine and you know, if you continue that timeline from the presidential election, just a couple weeks after that, the vaccines came out, and I was telling you before, I felt such a relief the moment that I got vaccinated.
Yeah, tell us. Sorry, this is actually pretty funny.
So, you know, if you think, and we'll get back to your question, if you think about the timeline of things not making sense in some ways, I am a believer in the vaccine. The data proves that and I'll just start with this, that you're less likely to die from COVID, 5 times less likely to die from COVID if you are vaccinated. And you get COVID and you're one of the people that it affects and it grabs hold of. So I do believe in it. I'll say, though, that I remember, you know, my lens was the hospital where the sickest people with COVID were, right? So you went home, you watched the news, everything about COVID was bad. And then I came to the hospital and I saw some of the worst of the entire world. And so when the vaccine came out, I mean, number one, the day that it happened was incredible, and then the day that I got the shot, I just felt great. I was like, now I'm suddenly protected. Things are going to start to change. And then I went home. I had a couple of reactions from it for a couple of days, and then after that, I was like, okay, we're good. We could take the mask off now. And then we weren't allowed to take the mask off, right? And the reason was, well, you know, you got to wait 3 weeks for your second shot, or you have to wait 4 weeks for your second shot. So I was like, okay, I'll wait the 3 weeks or the 4 weeks. And then I get the shot 3 or 4 weeks later. I go through my next 2 days worth of, you know, not feeling well. I come out of it and I'm like, all right, we're good. I can take off the mask, right? And then they're like, nope. 14 days after, that's when you're actually fully vaccinated. And I was like, all right, 14 more days. I could do 14 more days, right? And then 14 more days go, and I'm watching more and more people get vaccinated. I'm feeling good. We're going to get past this. And after that timeline, I'm like, great, let's take off the masks. And like, no, you got to put that back on. And I'm like, well, why do I have to put the mask back on? We're all vaccinated here. No. So-and-so may not be able to get the shot, and you have to protect them. And I was like, well, what's the benefit then that every individual will get to experience for having been vaccinated if they don't get to gain some part of their normal life back? And then more and more people get vaccinated, and the narrative changed again, right? It was no longer about get vaccinated. It was get vaccinated. Now get vaccinated for your neighbor. Right.
Then it was get a booster.
Then it was
get another booster.
Yeah. And somewhere in between that, by the way, we were all liberated from the masks.
Right.
Right? Because I think in May of that year, 2021, it was everybody could take off the masks. And then by July, there was another wave and another peak of COVID. But the question was, and I don't have the answer to this, but because I haven't looked at the statistics, but what was the impact on the healthcare system? Meaning, when that last wave happened, not last because it still keeps going, but when those waves are happening, is there enough hospital capacity to take care of the people who are ill? And if there's enough hospital capacity to take care of the people when they're ill, well, that's what the health system is there for.
Right.
And if that's happening when people are unmasked, then when do we get to the sense of this is going to be our cycle, and hospitals are going to take care of people when they're unwell, and they're going to be able to take care of the people who have things that are not COVID related and still have the capacity to do so?
why do you think the public is so easily forgetful? Do you know what I mean? Like, it'll be like, this is the thing. People will be shouting it on a rooftop, and then the next week they completely forget it, and they completely forget what they were shouting, and then they just end up by the end of the year like in a completely different place, and ignoring the fact that that's just like a human trait, and I don't understand it, and it's so frustrating to me watching.
It's an interesting dynamic, right? And so, is some of it just based off of what we're absorbing around us? Is it is it the influences that we have? Is it what we're following on social media? Is it the media? Is it what's in the news? Is it there are so many questions about it. But I have the same observation you do, which is when there's something very big in the news, everybody's focused on it.
Everybody has an opinion about everything.
And then it changes, and everybody stops talking about the last thing.
Right. Like the the Russia-Ukraine thing. Like, everybody was giving their opinion on it and all that. Like, they had studied either of the countries or knew anything about what was going on.
And I'm not saying I do.
Yeah, and chose a side, and they got mad at others for not choosing their side that they don't even know anything about. Again, I don't know anything about it, but I'm open that I don't know anything about it.
Right.
So if I talk to like a professor that studied Russian, okay, cool, teach me about their interactions. I taught history. I don't know anything about Russian-Ukraine interactions, relations. I know Ukraine wasn't let in NATO. That's probably not a great sign. Like, that's about the extent of my understanding of their relations. And then, like, when that happened is like I feel like when the COVID ended, and then like for whatever reason, and then what's the new thing? Oh, now the abortion.
Right. And people aren't really talking about Ukraine anymore.
Yeah.
But there's still a war going on.
Right.
Right, and it's still very real for the people who are there.
Very real. It's probably worse because it's still going, and I've never been in war, thankfully, but I can only imagine it only gets worse as time goes on. I don't imagine war gets better.
I would imagine the same. I haven't either.
So I can just that, and then you actually just told me I didn't even know because, again, just a distraction. The abortion leak was on the same day with the Pfizer. Would Pfizer release some documents being unfavorable?
I had read that somewhere. I didn't read the Pfizer release, but I did read one place that that those two things happened around the same day.
Again, I don't believe in coincidences. So, like, to me, if there's somebody wagging the dog, it's probably the big pharmaceutical companies. I would imagine that they have to be some of the most influential lobbyists probably in the world.
It would seem so based off of the last couple of years.
Right. Yeah, they're doing pretty well with the COVID scare and push and all that.
And I saw somewhere else that they also sponsor a lot of what we watch on TV. Right?
Oh, yeah, all the time. And from being in health insurance, if you see a prescription on TV, that's like $1,000 prescription. like those are not prescriptions the insurance companies love. If you see a prescription on the TV, how do you see? Did you see pharmaceutical companies interfering with the hospital at all or anything like that?
No. From my seat, I couldn't tell any of that interaction. The closest that I can tell from a relationship was just, everything everybody saw for Pfizer and Moderna and Johnson & Johnson for the vaccines.
Okay. That's at least good to know. But I just have to imagine that. And then, and you want to kind of tell the story about how you got into the CEO role, like your kind of long, winding journey to get to where you're at?
Sure. So I didn't anticipate that I'd have a life in healthcare. I actually grew up in a family that had a family business. It was an electrical supply store and everything that you can envision inside your walls and outside your walls for lighting a house, electrifying a house, building a building from the inside from the electrical components. And my great-grandfather started it. It was in East New York, Brooklyn, Brownsville area. And I spent all of my childhood spending my Saturdays there, going to work with my father. All the school breaks were there. All the summers were spent there. And, we always had this goal. I'd be the fourth generation to take it over. And I was always very excited about it. And I was actually so confident that I was going to take over this family business that I remember when I was in high school, I told my parents, I'm not going to go to college. And, in my neighborhood, that wasn't heard of, right? Everybody goes to college. You go to high school, you go to college, and then, you do what you're going to do next. And my parents were like, why aren't you going to go to college? And I said, why would I? You know, it's just 4 years in between me going to take over the business, which, you know, I could just jump right into it and I have a 4-year head start. And they, you know, I look back and I thankfully thank them to say, you know, they were like, no, you're going to have a prerequisite to take over the family business, and that's you're going to college. Go get a degree, and then we'll let you get involved with the business. I said, all right. So I went and I did everything possible to get out as quickly as possible. So I went there with college credits that I earned in high school. I went to college, and you know, in between those breaks, when you come home, I did summer classes, I did intersession classes, and I just did whatever I could to get out. And so I finished in 3 years.
Very nice.
And in that last session, that last semester when I was there, wrapping up, fully prepared to go and get into the family business, I get a call from my dad when I was up there, and he's like, hey, look, the business is gone. And I'm like, what are you talking about? The business is gone. And the timeline is, it was in the 90s, and that's when the Home Depots of the world came out and crushed all the mom and pop. You know, you heard about it about hardware stores, but this is, you know, effectively an electrical hardware store. And they just crushed. They undercut the pricing on everything that my dad was able to buy things from his distributors. And so they just absolutely wiped out the industry. And I had to figure out what to do with my life. And so here I am at the end of my third year of college, which I'm wrapping up. I'm graduating, and I felt like I needed to buy myself some more time. So I enrolled in an MBA program.
Nice.
I was like, let me just go back to school, right?
Yeah,
and
yeah.
So I had liked...
Where did you go to school on the side note?
I went to the University of Rhode Island as an
Okay.
undergrad, and then I enrolled at Hofstra University as an MBA student.
Yeah, so in New York.
In New York.
How far is I should know it, but I don't. How far is Rhode Island from like Long Island?
It's like a 3-hour drive.
Okay, not bad.
Yeah, not bad at all. 200 miles maybe.
Yeah, it's not bad.
Yeah.
It's nice to get away for a little bit.
Yeah, and it's a beautiful area up there.
I've never been.
It's nice, especially the Newport area, and the University of Rhode Island is a little bit, you know, it's a little bit before that, but it's a nice campus.
Okay.
And so I enjoyed the 3 years there, but I was also looking forward to getting into the real world. And when I was there, I started to have this interest in finance. Stock market was booming back then, right? And everybody was talking stocks. And
90s was.
Yeah, you had the internet bubble, right? And so I was paying a lot of attention to that in my business classes, and so I figured, let me go to Hofstra and study finance. And then after my first year being a full-time student there, I figured now's the time to start looking for internships. Let me get some, you know, my foot in the door, see what I like, what I don't like. Now, one of the things that I do is I'm a professor at Hofstra University, and I
that's what you teach.
Yeah,
Okay.
I advise interns, and one of the things I tell them is that is the best time in your life to get out there and to try something, basically with no commitment, and honestly try the things that, you know, either scare you or you're uncertain about, and use that as the time to figure out what you don't like, which is, you know, probably more important than figuring out the things that you do like, right? Because you don't want to have a life that you committed to in a career that you're just not going to be happy and fulfilled in. And so I spent 3 days on Wall Street. And I just felt like there was something about it that wasn't the right fit for me. And it wasn't the right time in my life to be on Wall Street. And as much as I enjoyed finance in that regard, it just, maybe it was the person I was paired with, I don't know. But at that same time, I had an opportunity to intern at the organization that I ultimately worked at. And so I thanked the people at Wall Street, and I went and I worked at the hospital setting. And what stood out to me there in a different way was, you know, I was in a finance office 7 miles away from the closest hospital. And the amount of caring and compassion that the people in finance had there for the work they did, having an impact on the care at the bedside, you know, just spoke to me. It spoke to me, you know, in my heart.
It's not what I would assume about the finance guys of a hospital caring about the patient. That's great to hear.
Every single number that, you know, that it was an incredible summer, because every single number and analysis that I worked on was filled with an education of them explaining to me how that number on the page impacted the care that was being provided then and how the work we did would impact the care going into the future. So I stayed. At the end of the internship, I was offered a job as an analyst, worked in that office for 9 years in different roles, doing financial planning and budgeting and capital planning, and then had the opportunity to move over to a hospital as the CFO, and a $1 billion hospital. And I was like, this can't be real life, right? Like, how am I having this opportunity? And it was a really exciting time in this hospital's history. And then, so I went and I did that. And then a couple of years after being there, my boss at the hospital, the executive director, hospital president, hospital CEO, whatever you want to call the title, asked me to go to Dartmouth College to join a program that was just being developed for hospital leaders. And it was a new program that was created based off of President Obama's campaign in 2008, I guess. And somebody realized through his campaigning that the healthcare system was so broken that the only thing that was going to fix it was to put a new program together and then bring a group of leaders together to learn this new program and then go out into the field and implement it. And so I was very fortunate to be one of 50 people that went into this program at Dartmouth. Yeah. And so it brought together the best of Tuck, the business school, and the Geisel School of Medicine, and TDI, the Dartmouth Institute, so that we would learn from the best minds, analyzing really what was the foundation for what President Obama was talking about during his campaign, and then go out there and do something about it. And then by the time I was done with that program, my boss called me in and said, listen, you seem like a really frustrated finance person. And I was like, what do you mean by that? She's like, you're really good at reporting out on the numbers, but you seem to want to do something about what influences those numbers. So why don't you try being the head of operations for the hospital? And so I went back, I talked to my mentor, and I thought about it, and with some support and guidance, I went down that road. It was a crossroad in my life. Do you leave something that you're good at and you feel comfortable in, or do you take the risk?
Yeah, because you just got, like, you're one of the 50 elite people. So leaving that has got to be it's a big risk.
Yeah, and so I was thankful for the support. And as you don't believe in coincidences, I was learning at that point in time in my career, you got to listen to those around you. Follow their nudging of, what they see in you and what your potential could be, and then trust them in what they think you could do and in their support for you. And so I did that. I made the transition to operations. I partnered with the chief medical officer and the chief nursing officer, and the three of us worked, I'll say till the day I left, we worked as a triad, right, with the rest of the administrative team. But a year after being the head of operations, I then became what was called a slightly higher level, and then the next year I was promoted to be the hospital executive director or president. And so I did that for about 6.5 years, and 2 of them were through a pandemic.
Yeah, but what a wild road. I mean, so I wanted to hear more about kind of that, the Obamacare essentially. Because that's just super interesting to me, because what I do for work, you know what I mean? Like, we're the exact direct competition, not to get into specifics, but to Obamacare. So I almost benefit from it being so expensive. Well, not almost. I benefit from it being so expensive because it makes it easier for me to sell my plan.
And just the creation of it, right?
Yeah,
the creation of that plan created that entire market.
It's
right,
it's
which didn't exist.
Right,
it didn't exist when I was going into this program.
So the whole thing is wild. So definitely no coincidence there, because I wouldn't know you if it wasn't for that exact thing. So you actually played a role in that, which is very interesting. What did you guys do in that meeting? Did you talk about like implementing it, the finances of it, like? So
it was less a meeting and more of a college program, right, at the graduate level. It was a lot of science, data, analytics, and then business courses, all brought together. I don't want to say was, because it still exists, and people can still look up the Masters of Healthcare Delivery Science at Dartmouth College. So you take all of those components together, and so think of your standard MBA program, right, from a business school perspective. How do you analyze a business plan? How do you do projections? How do you study a market? How do you understand efficiency and operations, right? all of that side of it. Then you have the science side of it. How do you, we were talking a lot about, some of our feelings about masks and whether or not they're effective. Well, how do you structure a data study? An unbiased data study, either prospective or retrospective, to understand the information to make a informed decision. So that, one of the things that we've lived through is a tremendous number of people disagreeing with one another over the last couple of years. Some of it's based on feel, some of it's based off of, Facebook posts and what, someone's aunt or cousin is telling them to believe, and some of it is based off of science. So then when you get to the science side of it, how do you understand it? What was the structure of that? And then how do you interpret it? And then you can couple that with the business side of things and affect change. And so, when you look at those components, it was specifically designed in this program to challenge the way the U.S. healthcare system is designed, so that we can effectuate change in how it needs to be changed today to implement the future outcomes. One of the things that shows up time and time again in these studies is that the amount of money we spend in this country on the end of life care for people is
so like right at the end, like hospice type stuff,
and pre-hospice. Right,
okay.
The last 6 months of somebody's life is where they spend the vast majority of the Medicare dollars.
Okay, that makes sense.
Right, because we in our society we have this culture of believing that longer life is better than quality of life.
I'm so opposed to that.
To what I just said, or
no. No, I agree with what you said.
Yeah.
I'm just opposed to that thought.
To the concept.
Yeah.
And as am I, right? And so some of this program was about teaching that. But the question is, how do you start to change some of that dynamic? And while simultaneously, I believe, creating a structure of preventative care and healthy living to inspire people to make the right choices and make it easy for them to make the right choices, so that they don't need to have as many care delivery systems involved in their care at the end of their life.
Yeah, I feel like our whole healthcare system is all reactive instead of proactive.
Yes.
Right? And my view with COVID was the reason, again, I didn't work in a hospital. I don't really know shit about it, and I understood that. But what I thought was weird was they were telling everybody to stay inside and not get sunlight, which increases your vitamin D and your immune system. And there was no like exercise, and then it was like, all right, this is really affecting people that are overweight. Why aren't we telling them exercise and eat better?
And get outside.
Yeah, and get outside and go for a jog. And that to me, and I was like, all right, so they don't really want to make you healthy. And God knows what the inflation and the other stuff is going to come from those 2 years of just lost business and productivity. And
well, think about, there was a night I was at the dinner table with my family. It was in January of this year, 2022. The numbers in New York are starting to really climb, very high. And tests were nowhere to be found, right? The home tests were nowhere to be found. And the schools started saying, we got some tests. Every child gets to pick up one, right? And the families have to go and pick it up. And everything that you saw on the news was, cases are going up, we're going to give you tests. Well, how's that treatment? How is taking a test to know whether or not you have COVID or not treatment? And I feel like, you were talking about the news a little bit before. Is that a little smoke and mirrors?
Right.
For, making you believe that you're doing something, right? What's the value add in doing it? Now, clearly, if somebody has COVID and they stay home and they don't spread it, well, that's a benefit for it. But what's the actual treatment for COVID?
What is the treatment for COVID?
Stay at home.
Stay home.
Stay at home and rest. And, I'm not a doctor, so I can't tell you more than
Okay.
that. There's a lot of people you could talk to that will get you that information. Yeah. They'll give you recommendations. And for different people, I believe different things work.
For all my friends that have had it, I have a guy on my team. I think I've referenced this before in some of these podcasts, but I have a guy on my team that's had, I'd laugh, it's not funny, but he laughs about it too. He's had, I think now, 4 heart attacks. He had 3. He just had another heart thing happen the other day. He smokes about a pack a day still. Bigger guy. He got COVID. Or like there was a period where like most of my office got COVID, and I called him and said, "Do you have a will together? Like you are who this kills." And he was fine. Every single, I mean, again, obviously you saw terrible things, but everybody I knew that got it, other than one person who actually, it's funny, he said the minority thing, he's a minority, was fine. They just slept. I never got tested positive for it. I think I had it once, and I was just tired. I was just really tired for like 2 or 3 days, and then I felt good.
Yeah, you never got tested, right? And so
No, I never got tested.
You know, I
was like, everybody I'm around has it. I feel sleepy. It could just be my mind, but my view is like, from everybody I talked to that did get tested, they weren't told anything or what to do. I was like, so why? I'll just stay home, take a nap every day.
And it worked for you.
Yeah,
and it works for most people that I know. You know, they take some Tylenol, they take some Advil. To the best of my knowledge, I have not had COVID. I've had days where I felt like I had COVID. People in my house have had it and tested positive and had cold-like symptoms. Interestingly, I never got it from them, which I find curious.
Especially because you must have been around COVID all the time, nonstop.
Face to face with it.
Right.
Face to face. And look, we had, in a very short amount of time, the N95 masks that we were wearing, and while we had protective eye goggles, I never really wore them so much because I wasn't in that kind of a setting. But face to face with it, and you wore it for your entire time that you were in the hospital, and I felt safe with it. But I never got COVID. There were days I was so exhausted from just working so many long hours, just constant, and it's hard to describe the amount of emotional connection to what you're doing and managing many different aspects of what's happening in any given moment. And at some point in time, my body just shut down, and I thought I had COVID then, but I didn't. There were days where I just couldn't lift my head off the pillow.
What was your sleep schedule like during the height of the pandemic?
3-4 hours.
That's what I was
maybe.
Gonna guess.
There were times I'd round in the hospital and I'd go into my office and there was a couch there. I'd never lay down, but I would sit down and I would just be tired. And there were plenty of videos of me in that moment where I would start answering questions on social media, and people would message me and they were like, "You need to get some rest. You look terrible. You need sleep. You got to just, take care of yourself." And there were moments where, when you're sleep deprived for way too long, you get a little bit, what's the right word for it?
Irritable for me.
Irritable. Yeah.
I get super irritable if I don't know.
It's like when you don't eat and you're hangry, right? And after weeks of that, different people would start to show that at different times. And I think one of the strengths of us as a team was we have a good enough relationship where when we saw that in somebody, we'd be like, "Hey, look, you just got to go home. You need to take a remote day. You need to, there were plenty of tools available, Zoom and Teams and other things that popped up that you were able to stay connected, but somebody just needed 4 extra hours.
Yeah.
And so we would cover each other and do that from time to time. But I want to go back to something that you said, which is really important about all of this. And it's a question really more than it is, a statement, but it's, why isn't there as much involvement in the communication strategy around this virus for health and wellness activities and diet and nutrition choices as there is around just getting the shot?
Right.
How do we use this? Again, I'm the type of person who thinks about the lessons in what we go through. And, my lesson that I took away was I wanted to be more present as a father, as a husband, for people, and rebuild relationships with friends that, hadn't maybe stayed as strong as they could have over the years. But the other thing is, we should be giving people the recipe for success in life, a good quality of life, helping them promote their wellness, helping them to stay active, helping them to get outside, helping them to have the right mindset, right? All the things that you and I are really fortunate enough to be learning about in the 365 program, right? That's the recipe for everybody that, will really deliver success and a positive mindset and respectable ways for people to grow old.
How do we get, I guess you're doing it with the social media stuff. What I was going to say is, like, how do we get that happening? I guess we just have to do it. Hope it catches on. I don't think us relying on the government or somebody to just implement it that way is going to ever happen.
Yeah, I think, you start to go down a road of reimbursement before to organizations and their coding of how people passed away with COVID, or if they didn't pass away, there still was coding opportunities. So if that could be done, how can the government start to incentivize all of us to live healthier lives? Or how can the government start to incentivize restaurants to serve healthier foods? One of the things I did when I was at the hospital was I changed the pricing in the cafeteria. I took the unhealthy foods, which, by the way, I love from time to time, so I'm not going to tell you that I don't love a chicken finger and a mozzarella stick. Right. But I made that expensive, or more expensive than a healthy salad. And so we lost money on our salads. We made a lot more money on the other food. But the incentive was, for a lot of our team members who live on a budget, for $5.99 you can get your salad and a bottle of water, as opposed to $5.99 for your chicken fingers, your French fries, and a Coke.
Just think of how much more pep in their step they probably have for the rest of the day and stuff.
Yeah, I mean, it was a little bit of a transition, right? At first, people were like, hey, why'd that go up in price? Well, the salad's over here. You can choose the salad, and, I don't want a salad, right? And then over time, people would start to choose the healthier options. Why can't we do that as a society? And in 20 years, suddenly we're living different lives. One of the things I think about in the future, right? We're going through this very focused time on healthcare. I can't think of another time, at least that we've been alive, where so much attention has been on health or health care. But we're living through a time.
There's more obesity, and they call it fat shaming now. Right. Like, again, I'm overweight right now, right? I know that. But, like, it would not be good to me if I lied to myself, told myself that that's healthy.
You can be a beautiful person.
Right.
Right? And recognize that there's, you can live a healthier lifestyle from a weight perspective. Right? And what I've seen is that, I saw this very quickly when I got to the hospital, when I started understanding from the physicians and the clinicians some of the outcomes that weren't as good for patients. I'm like, what's the difference? What drives a better outcome in most people? And they said, your health and wellness and how you live your life before you need medical care. Right? So if you're a relatively healthy person and you go into a hospital, you have a better chance of having a speedier recovery and a better outcome during surgery, if you're either having one or the other, or both. And so, I went to the hospital, I was 40 pounds heavier than I am right now. And I immediately joined Weight Watchers because it was offered. It was a benefit. I lost 30 pounds, and that was 12 years ago. And while I may go up or down 10 pounds here and there, I have for 12 years kept off that 40 pounds. But the crazy thing is I'm still considered obese, right? And
are you really?
Yeah, based on the BMI metrics.
No shit.
Yeah, and so I'm trying to get under that level. But
I don't want to see mine then.
We may be in the same bracket.
Yeah.
We may be in the same bracket. But the goal should be that, we promote health, because what scares me about the future of healthcare is we're going through the Great Recession. Resignation. The recession's coming next.
The recession is coming.
The recession's coming next, unfortunately, between inflation and...
I think everybody sees it coming, and nobody wants to truly acknowledge it. But again, I don't know if it's true or not. I was saying before, I heard from... I wish I could remember the name, but this high-level, economist, which I think makes sense, with the Russia-Ukraine thing, when every country sanctioning Russia. Again, I don't pretend to know what they should do, but with them doing that, the natural progression for the Russian farmer, who provides most of the wheat in the world, is not to grow as much wheat because they won't be able to sell it, and then their own crops will be cheaper in their own land, so there's going to be less wheat. Plus, prices are already going through the roof anyways for anything. I can't imagine that does not have a serious effect.
I think they said today oil hit the highest it's ever been for home heating oil. Maybe not highest it's ever been, but highest it's been in our recent times.
And again, I learned this in my college classes. Oil is cheaper and easier to get now than it ever has been because of our technology.
Interesting.
People we use this shortage term, but really interesting book. So the recession in 2008, when gas got so crazy prices, I think it was 80% of that was stock market pushed up.
Really?
Yeah, because there's in '95 the J. Aaron Gold Act or whatever that was, got rid of the Glass-Steagall and commodity speculation. Like there's no limit now. So like what happens is there's actually oil tankers going around the oceans just filled with barrels of oil to drive the price up. So 'cause most of it's usually actually like.
So it looks like supply is down.
Yeah, exactly. And so when we blame like Ukraine and then gas went up, I went on the government site. Like I didn't rely on anybody else. We get, I forget the exact amount that we get from us, but from Russia we get like 2% of our oil, or something like that from Russia. Like it was like there should have been no reason for that to go up.
That's interesting because it sounds like we get most of our oil from them, right?
That's what I'm saying. Yeah, I literally went through and I counted the amount because you can go on the government site and it'll show you the country and the amount of barrels of oil we bought.
Wow.
So I went and averaged. I did like. I was so frustrated because I was like, I don't think we get that much from there. And I was like, I think we get 60% of our oil from Texas, which we do, or something like that.
Wow.
Yeah, just like Texas alone. And I was like,
that eliminates the entire argument.
That's what I'm saying. Is I was like, there's no way that's accurate. Like, and I went and checked. So we don't get 60% anymore. From Texas we get close to that though. But like American production is by far where we get the most of it. And I went and like calculated it, and Russia was like one of the smallest. And went back and like averaged it and then figured out. I have it written down on my phone actually. It's a 2 to 3.5%. It's not more than that though.
Okay. Wow.
Yeah, Mike's confirming. He just did the research. Yeah, it's wild though. And but the prices go up $1.50. And it's how can you? And again.
So then where's that money going?
Exactly.
Right.
I think it's we don't want to admit because we were talking before. It's politics. They're going to say it's not inflation, it's Russian force, right? So they have a boogeyman that they can point the finger at. Mm-hmm. And again, I'm not saying Russia's not doing fucked up shit. I'm just saying I don't know the politics of that, but I do know the politics of the oil, and that doesn't make sense. It's cheaper and easier, and we produce most of it in America.
That's interesting.
But you would never know that.
Right. I'm going to look that up after this.
Yeah. I'll send. I think I have it in my phone. I even send you like the link, the site to go to within government has. Okay. But it's like I googled like barrels of oil something. I don't remember, but I'll send it to you. It's the official like .gov. Mm-hmm. And that happens all the time. Healthcare, all that. And again, people are just so easily distracted. Hey, make an opinion about this and get in fights.
Yeah.
Well, the important stuff's going on and nobody pays attention.
Right. And so getting back to some of that important stuff, you look at the Great Resignation, and you look at an aging population, and you forecast out the amount of need for medical services that we're all going to need as a society over the next 40, 60 years. There aren't going to be, in my opinion, enough places to receive that care if we don't change the trajectory of how we're living today so that less of that care will be needed in the future. Right? We're either going to have to build a whole bunch more hospitals and hire many more clinicians and people to work in them who are leaving the field today, right after living through 2 years of, in many ways, trauma.
Like you did.
Yeah, exactly. And I'm not the first, right?
Right.
I haven't been the last. And so, there's a movement that's going on where some people are just leaving the field completely. There are some people who are changing the setting in which they work, right? So if they worked in an ICU or they worked in a medical surgical unit or an ER, they now want to go work in an outpatient practice, right? Normal hours and very few emergencies and a lot less intense. And so if you've got that dynamic taking place, what is the industry going to do to bring people back into it, right? To me, there is a pride of working in a hospital when the world needed you most, right? That's what the pandemic is for healthcare. It's the World Series, it's the Super Bowl, it's your 100-year,
right,
super event that you're going to go through that you never want to happen. But when it does happen, and it has to be managed through from a clinical perspective or from a leadership perspective, it doesn't matter. That's your time, right? That's like the quarterback at the end of the game saying, give me the ball, I'm going to go score a touchdown, right? That should have driven, in many ways, more people into the field of healthcare. There should have been such a positive force that we all experienced in that first wave that continued to this day, should have continued to this day, and would have made this the field that everybody would want to be in. Because healthcare workers saved humanity, right? That's what the message should have been. Instead, they were made to feel in many ways dismissed and, just, people to pick on for the vaccines and thankless for the work that they did, tirelessly giving their lives, putting themselves at risk, putting their families at risk with so much uncertainty. And I fear that situation over the last 2 years, or a year and a half of it, has created what's going to be a vacuum for healthcare workers into the future at a time when more and more people are going to need those services.
That's really interesting. Yeah, and that'll be $1 billion question for somebody to answer.
Yeah.
Is how do you incentivize them back?
How do you incentivize them back, and how do you incentivize everybody in the country to live healthier? It's hard, right? That's the problem. It's hard. It's not
so much easier to eat that fried chicken, which I had today.
As did I.
It was delicious.
It was delicious.
Yeah, it was. I don't regret it, but it's so much easier to do that, and have a beer than drink water and a salad.
But yeah, to go find the fresh vegetables, to go find the ingredients. It doesn't get delivered everywhere. Right. And if it does, it's not always as nutritious as when it was picked from the ground. And
I want to have a farmer on here because I've been reading all this stuff about like soil lately. Basically, like our plants, even like when we do eat healthy, are not what they used to be.
Interesting.
Because the nutrients, we've just been destroying the ground, like this mass farming, like. So the plant is still lettuce or carrots or whatever, but it used to have so much more nutrients, and like a lot of them are like not even there in the soil anymore.
I hadn't heard that, but I did hear that the method by which it gets delivered and how long it takes us to get that food, right? That's why the people that are in the health and wellness space and nutrition will recommend going to a local grower,
right?
Because you want to get it as close to the source as possible, and so. When you go to the big box chain stores, right, it's already been frozen, it's been sent, it's been weeks before it gets to you, and each day that passes...
It loses a little bit of the nutrients.
It loses its nutrients, right. And so by that time you get your salad in the bag, are you really eating anything that has any nutrition?
Right.
It's still better than chicken. the fried chicken.
Probably still better than like the apple pie and stuff. Yeah.
And when I say better, I mean healthier.
Right. Definitely, yeah.
But I will also say when from experience, when I've eaten strictly healthy for a period of time, the fried chicken doesn't taste as good anymore.
Right. It's like I don't know if you ever smoke cigarettes.
No.
I used to smoke cigarettes on occasion, like here and there, and then once you stop, then like the smell of it is like the smell of it never used to like really bother me that much anymore. But then the smell of it after, you're like, oh, it's fucking disgusting.
Yeah.
It's like your body's like, no, don't go back to that.
Mm-hmm.
Please don't do that.
Yeah.
That's kind of an awesome way to end it too. We hit over 1 hour 10. So,
all right.
So the streak continues.
There we
go.
The streak
continues.
We had a goal. And,
yeah.
But I still think we could rival Joe Rogan. We can go for 3 hours.
We could do 3.
Yeah. Maybe we'll do it in 3 segments.
Don't worry, I'm not going to do that to you, Mike.
We'll do it in 3 segments.
Yeah, absolutely. So guys, I want to thank you all. Hopefully you guys learned something. I know I did. That's always the goal here. Free game, free, unrestricted game, life lessons. Michael, I appreciate, how you come, man. Appreciate it.
Thank you very much.
He's flying in and out today just to do the podcast.
It's my pleasure.
That's awesome.
It's good to see you.
Good to see you, man. Good to see you.